That's interesting.
What is a sexual?
Yeah. Well, so what does a healthy? He's a.
Okay, can I have a second to think about that?
And then this morning the pilot was yanked on us.
Are you kidding? Captain Hubbard? He has more hours than anybody in the squad.
Oh, sure, he's terrific, but he got sick or something. Say he picked up some germ.
The American Sexual Health Association was founded in 1914, but is the American Social Hygiene Association. It was in New York City, and gonorrhea and syphilis were rampant, and nobody was talking about it. So several social elites, to include Katharine Hepburn's father, decided we must do something. Before both World Wars, the government came to us and said, we need your help with making sure soldiers understand sexually transmitted diseases and prostitution, and the ultimate goal was to keep soldiers fit to fight.
How do you do, Doctor?
Hello, Colonel. What's the matter? Need a prescription for orange juice and castor oil?
No, I've come for a blood test.
Oh, good idea. I had one myself last week.
I brought some friends along. I want them to see how it's done.
Splendid.
In 1960, the American Social Hygiene Association decided to change its name to the American Social Health Association to keep up with the times. There was a lot going on at the time. Drugs, sexual revolution, the pill, Roe v. Wade, and then in the 70s we started to see STD rates start to climb. In the 80s, ASHA had a call center where we were helping Americans understand the subject of herpes. And then the CDC came to us and said, hey, can you help us with this new problem that we have? We're getting lots of questions. And it was HIV/AIDS. So that turned ASHA into the world's largest health educator on this new and serious health threat. ASHA is all about progress. That's why we recently changed our name again and changed it to the American Sexual Health Association to reflect our new mission, vision, and leadership in sexual health.
But how to get the truth to so many millions on a subject so forbidden?
I've been doing sex education for about 10 or 12 years at the Kinsey Institute. And the Kinsey Institute has this great tradition of receiving questions about sexual behavior and sexual health. And then and now, some of the most common questions really revolve around, am I normal?
A sexually healthy nation looks to me like where we have the resources and tools that we need to make the best decisions about our lives sexually.
That can be anywhere from having access to birth control, being able to just reach out and find out new information about STIs, maybe they're having relationship problems. It's a lot more than just sex. It's building healthy sexuality and building healthy relationships.
In 2010, we published the first nationally representative study of sexual behavior in the United States in close to 2 decades. So the whole notion of the complexity of the sexual lives of Americans is something we found quite stunning, quite unexpected.
More than half of women, about 53%, and almost half of men have used vibrators. About 2/3 of Americans have used lubricants.
We remain highly sexually ignorant. We should have ongoing educational opportunities for adults to explore their sexual behaviors, to explore in their relationships. These are important things we should teach young adults.
It's that sex education they get in the schools. If my boy hadn't known about such filthy things, he wouldn't have got curious.
Young people are doing better than they've done for many, many years. The teen birth rate is down 44% since 1990, and young people are both delaying sexual initiation later than they used to, and they're using condoms and contraception more consistently than they ever have in the past. That being said, 2,000 young people still get pregnant every single day in this country. 10,000 contract a sexually transmitted disease, and 33 get HIV.
Here you go, Mikey. You eat it.
We never really had the talk necessarily. It was more, you know, as it came up, she told me more as I got older.
It was more trying to introduce it into our everyday conversations. Maya is also a big reader, so one of our tactics was to just have books lying around the house because she will pick up anything and read it.
And she also says I listen to books more than I listen to her, which might be true.
I do remember, I think she was in first grade when she came home one day and said, you know, Mommy, Tommy said he found somebody giving someone a blowjob on the internet. When, you know, your 7-year-old comes home from school and says that, okay, and you're like, think about how you're reacting. And then we had a conversation that was appropriate for a 7-year-old.
Of the 60% of checkup visits that young people had with their physician, only 60% included any mention of any issue related to sex. And the average duration of those conversations was 34 seconds.
It takes a village, and if we are abrogating our responsibility at all levels, whether that's a school, a healthcare provider, a government, then asking young people to act responsibly is hypocritical.
I feel a little bit more comfortable talking to my mom because nothing I say will ever make it awkward between us, and moms will be there for you always. So.
Yeah, you can throw that in there.
A sexually healthy nation looks like a place where we accept ourselves just as we are. Our bodies aren't perfect, our relationships aren't perfect, and they don't have to be, and they never will be. And we just have to realize that that's normal. It's part of being human.
Educate yourself before you do anything. Having a clear understanding of the complex factors that affect their sexual culture.
Ann, this is Woody. Well, I have a ticket for the High Teen Carnival Saturday, and, well, would you like to go?
That'll be fun.
Yeah.
Bye. A date with Woody. Saturday.
My husband's name was Doug, and he was a very serious person. He was older than I was. He was 10 years older. Wound up getting married in my early 40s, and we were married for about 8 years. And then he passed away almost 2 years ago.
Highlighted area came from Health First, so
it's so difficult to put yourself out there, especially online. I love it. She's inspiring.
Just been trying to put myself out there a little bit more and just make sure that I don't turn down any opportunities that might come along. Most of my friends over 50 are single, and we talk about what our common challenges and experiences are. We have all been approached by men that are much younger than we are, and so that's interesting. I think people over 50 are well informed, but I think there's still a lot of misinformation out there about sexual health, sexual activity, and for women especially, I think after menopause or childbearing years, a lot of women feel that that part of their lives they don't have to worry about anymore. I think a sexually healthy nation would really entail knowing what changes take place with our bodies as we age, but just being in tune with our wants and needs and desires, embracing our sexuality in whatever forms it comes in.
A healthy nation is one that's inclusive of all identities, you know, recognizing that for many of our gay, lesbian, bisexual, and transgender people, they're not included sometimes in those conversations, and they're not receiving information that applies to their identity and who they are.
Everybody would openly talk about their sexual orientation or their experiences with sexuality without fear of judgment from other people. There'd be greater sexual pleasure being had by all.
This one is more substantial. We'll just let it grow a little more. 21 is when I came out. It was really rough for me too, because I came out, it was in the 80s, and so not only was there all the bullying, but it also seemed like a death sentence.
I didn't have the traumatic coming out that I see a lot of my friends have had, but I have a lot of empathy for it. When I was very young, there were a lot of folks who were very, very much in the justice framework who said things like, we're okay, we are good, we're just like you. Well, what happened in the last 5 years is that's come true. All of a sudden, people know people are gay and we're not boogeymen.
We really thought a lot about marrying. It's a big debate in the gay community. And we decided yes, that it would be a good thing to do. It did make us feel like more as a real couple. And it makes us feel more recognized by society, that our relationship has equal worth and merit.
Sexual health for everyone is important, regardless of your orientation. In particular for gays and lesbians, since we're in this new period of kind of in the spotlight.
I was very young, but we lived through the AIDS epidemic when it was really bad in the 80s.
A sexually healthy nation is one in which there's a lot of acceptance, patience, the idea that it's okay to not be identical and the same, as long as something is safe and doesn't harm, that, you know, it's gotta be okay.
Ready?
Things that should be very straightforward, like an HPV vaccine to prevent cervical cancer, really become loaded, controversial issues in a way that they absolutely should not. And that's been disturbing.
So now we've moved in HIV from a very specialized testing situation to now we're asking every clinician to automatically screen folks based on their age. And so if we just chilled out a little bit and said, hey, you know, this is part of life, like any illness is part of life, then it would become less and less an issue for someone to step up and ask for the service.
Having policies that promote rather than prevent people from being sexually healthy is just really critically important.
But the work has only begun. There is much to do. Government and citizens have a tremendous task ahead. Parents can guide, protect, and instruct growing children. Communities can provide facilities for wholesome play.
For an organization to have been able to make those kinds of changes and to survive through 100 years is really extraordinary.
Sex should be open, sex should be delightful, it should be fun, it should be energetic, but it should be something to where we just want to talk about it.
So that maybe people could start a little bit earlier, maybe figure things out a little bit earlier without having to fight against what they've been taught.